And now let's switch gears to health matters, where Nigeria is on high alert as Mpox cases surge globally, raising concerns about potential entry of an aggressive variant into the country. In response, the Federal Ministry of Health has issued a nationwide warning urging states to intensify surveillance and preventive measures to prevent the virus from being imported. Although no cases of this aggressive variant has been reported in Nigeria, states are not taking any chances on how ramping up their surveillance efforts. Public awareness campaigns have also been launched to educate citizens about the risks and prevention strategies. Nigerians are being advised to avoid close contact with anyone showing symptoms, maintain good hygiene, and report any suspicious cases to health authorities. And to unpack this, we're joined by a medical expert, CEO, Dr. Nesochi LLC, and that's Dr. Nesochi Okeke-Igbokwe. Good evening, glad to have you join me on the news.
Thank you for having me.
All right, talk to me about the key symptoms of this aggressive Mpox variant that Nigerians should be aware of.
So first we have to understand what Mpox is. So Mpox is essentially an infectious viral illness that's a member of what we call the orthopox virus family. Now there are two types of Mpox, what we call clade 1 and clade 2. Clade 1 is what we see that's endemic in the Democratic Republic of Congo. Clade 1 causes more severe symptoms and can cause increased mortality. Clade 1b is the variant at this point in the Democratic Republic of Congo that the international community is concerned about at this point. So clade 1b has been seen to spread in the neighboring countries next to the DRC. And then we have clade 2. Clade 2 is what's causing, or what caused, I should say, the global outbreak back in 2022. This is less severe, more people survive this, and this is what is typically seen, clade 2, in West Africa. With that said, to answer your question in regards to symptoms of Mpox, symptoms usually are going to begin within about 1 week of exposure, but it can start anywhere between 1 to 21 days post-exposure. So the symptoms will begin with a flu-like illness. So one can start experiencing symptoms of fever, headache, muscle aches, chills, swollen lymph nodes, and of course, a characteristic rash that can spread throughout the body.
Apologies for butting in there, Dr. Igbokwe. I mean, we do know that when it comes to issues of diseases, I mean, health workers are often at risk. What are the most effective infection control measures for health workers handling cases of Mpox?
Yeah, so in regards to precaution for healthcare workers and the public in general, one thing that we need to be aware of is the role of vaccines. So Nigeria did recently receive 10,000 doses of the Jynneos Mpox vaccine. Unfortunately, that's only going to cover about 5,000 individuals because it is a 2-dose series, but vaccination is quite important. Another thing is to avoid close contact with those who have active lesions, active infections. So in the context of a healthcare worker, we have to ensure that they have the appropriate PPE and they have the appropriate supplies in order to adequately take care of any patients that are ill with Mpox. And also avoiding contact with wild animals in areas where we see high levels of Mpox. So those are really major precautions that can be taken. Of course, public health metrics like increased infection control, hand hygiene, if you were to be around anyone that is ill with Mpox.
Now, staying on the talks about precautions, I mean, what are the potential risks or benefits of implementing travel restrictions to prevent Mpox importation?
So that's certainly a consideration. However, we know that Mpox has been endemic. The various types of Mpox has been seen in Nigeria in the past. So in regards to travel restrictions, I think we just have to be more so on high alert because it is now a public health emergency of international concern, meaning that that's the highest level of global alert. So it's really just a call to action to ensure that we are doing what needs to be done to contain the spread of this virus.
Well, thank you so much for your thoughts on the news. A medical expert CEO, Dr. Nesochi LLC, and that's Dr. Nesochi Okeke-Igbokwe. Many thanks indeed.
Thank you for having me.